and that is a state-of-the-art early intervention system for the Minneapolis Police Department. Now, our overarching goals here are safety and reform, all with the mind of benefiting our constituents. And in getting to safety and reform, you have to understand that it's not just about making policy changes on a paper. It's not just about implementing some new program. This is about people. Police officers are people. The residents that they're charged with protecting and serving are people. People make mistakes. People have life situations that happen. People go through difficult times at home and in their job. And what this early intervention system is built to do is track all of it. It's built to make sure that we're sussing out problematic situations before they arise. It's based on helping officers get what they need to be their best versions of self. Making sure that they have the tools that they need, the training that they need, the well-being that they need to do their job with excellence. That's the goal. That's the idea that all of our officers want to get to. And so this whole early intervention system is built to help them. It's set up in a way that it's a platform that allows customization specifically to what the Minneapolis Police Department needs and our broader city enterprise need. We've staffed it with the necessary individuals to make sure that it's not just about having a system set up that isn't used, but it's fully comprehensive and integrated throughout our police department. And let's be honest, policing as a profession has changed pretty dramatically over the last several years. Policies and reforms, they're being updated all the time. Best practices are evolving, and communities, rightfully so, they want accountability. And all of those are things that we're committed to. Again, ensuring officers have the tools around them to make sure that they're doing their job, not just right, but with excellence. And so we're asking a whole lot from our officers. They're doing long hours, sometimes in the form of overtime. They're encountering difficult situations where sometimes they need to make split-second decisions that involve serious issues. People give them a call in some of their worst moments of life, and we want to make sure that officers have all of the tools that they need to do that job really well. And so the data collected with this new system will help the supervisors of individual officers see in real time which officers need some form of early intervention and to get them back on track with some form of additional support. And I'll tell you, it's already paying dividends. During some of the testing phase that we've been rolling out, our early intervention system team was able to identify a few officers in need of some form of retraining. That training was scheduled, and those officers got the support they needed to appropriately improve their work. So again, this is about helping officers do their job. This type of system, however, is not just good for officers. It's good for our community, too. Our community that's expecting a top level of service for safety, our community that's expecting accountability. And it helps them continue improving so the officers continue improving so that they can show community and the residents who live here that we really are about making the necessary changes that we talk about. So we're really excited to roll out this system to our entire Minneapolis Police Department force and see the improvements that we can make. Getting here today took a ton of work. As I mentioned, it's been the better part of 4 years that we've been working on this to get it set up and rolled out. We are working through a settlement agreement. We have an anticipated consent decree that's coming down the pike as well. And so all of this work needs to be integrated, not just with what our expectations are, but also with those that will be overseeing some of these reforms, the feds and the state. A big thank you to our Chief Information Officer, Paul Cameron, and Arrow Keekson from IT, our City Attorney, Kristen Anderson, Jennifer Saunders and Amelia Huffman from the City Attorney's Office, our COO and Acting Civil Rights Director, Margaret Anderson Kelleher, and Interim OPCR Director, Carolina Amini. From the MPD, big thank you to Chief O'Hara, to DC Glampy, to Commander Wilkes, Commander Fours, and Nick Barkley. And Commissioner Barnett from the Office of Community Safety. All of these individuals have seen the need for this system, the need to support our officers, and the need for us to continue really showing up for our community in the best ways possible. And so thank you to all of them for their extraordinary dedication through this phase. And with that, I will turn it over to our Commissioner of Community Safety, Todd Barnett.
Thank you, Mayor. Good morning. I'm Todd Barnett. I'm the Commissioner of Community Safety here for the City of Minneapolis. As the Mayor mentioned, this is a great moment for us here in Minneapolis. And I'll start by acknowledging some of our key partners in helping us get to this moment. I want to thank the Polad Family Foundation and its president, Susan Bass Roberts, for her amazing partnership here and the regional leadership that they've shown. I also want to thank those who helped us with technical assistance in providing this program, which includes the National Leagues of Cities, Rainbow Research, and Ubuntu. Before I talk about the early intervention system, I think it's important to acknowledge that this is just another tool for us to use to help our officers in their well-being, which will ultimately help our community. We ask a lot from our officers. They work in a stressful environment, and historically, they have not always asked for help. And this early intervention hopefully would get us in a better place. They are used to answering the call for others, and it's time for us to be proactive in helping them. We want their family and loved ones to understand that by this early intervention, the city cares about our officers, and we want to be proactive. The early intervention system is a data-driven system designed to track employees' performance. One of the things is not just thinking of where we intervene early for those officers that might need some help, but it will also show us our high-performing officers as well. This system is designed to work as a risk management system in which we identify our officers that might be struggling in their personal or professional lives and need intervention or some support or some training before something adverse happens. This is not a punishment. This is not discipline. This is just a risk management tool for us to use to invest in the health and well-being of our officers. This does not replace any system that we have currently in which residents need to file complaints. They can file those complaints in the ordinary process that we have now. This is not an alternative to any future or current disciplinary process. Like I said, this is an early intervention for our officers, just another investment for our employees, which ultimately, like the mayor said, will serve our community well, will serve our residents well, and visitors. Thank you. I'll turn it over to our CEO, Margaret Anderson Keller.
Good morning. I'm Margaret Anderson Keller. I'm the City Operations Officer for the City of Minneapolis. Thank you, Commissioner Barnett. Thank you, Mayor. Thank you, Chief. Thank you to our team behind me. Sometimes people ask about our government structure and what does it mean. And I would say this is an excellent example of what the government structure change means. This is a team effort, and it's a cross-collaborative effort to be able to deliver this early intervention system on behalf of the city both with the IT department, leading a lot of the work to this point, as well as the Minneapolis Police Department. The changes that are required by the MDHR Settlement Agreement and the future consent decree really has highlighted this cross-departmental work, and this is a great example of it. This has been a big lift to this point. It'll continue to be a big lift as we go forward. I want to particularly thank the Information Technology Department, both our Director of IT, Paul Cameron, who is here with me today, as well as the Director of Technology Services, Arrow Kilkson, who is also with us today, and the entire information technology team. This is an important part of what we are doing here. It's not just a software system. This is accountability. This is accountability that will flag potential concerns for supervisors before a major incident can occur. It will allow for officers to get the support that they need. We are very proud in our work in the Office of Public Service to be working with the Office of Community Safety and to be delivering with the Minneapolis Police Department this early intervention system. And now I'd like to turn it over to the Chief of Police, Chief O'Hara. Thank you.
Good morning. Just briefly, I'll add to the comments that have been made already. An early intervention system is essentially a means to bring together data that's in siloed places around the city. So if you think about it, the way information is kept, if we look holistically about all the information that we have about police officers, there's some informations that are in the police records management system, some information may be in HR databases, others may be in other places like payroll, regarding overtime, and so on. This type of early intervention system, also obviously internal affairs records and OPCR data. This type of system essentially looks to take all that information, pull from it, and bring it together in one place so that we can identify outliers. That's basically what an early intervention system is. It is not discipline. Early intervention is meant to identify, patterns which may be problematic. They may be perfectly fine, but they may indicate that there is a problem underneath that needs to be addressed that, may not be individual to the commanding officer or to an officer's immediate supervisor. So kind of in a nutshell, it looks to bring together data and leverage that in a positive way to correct behavior before it becomes problematic. That's essentially what early intervention is meant to do. The level that is being contemplated here is the state of the art in this profession. That being said, it is not easy. This is not something that's easy to do. It's not something that's easy to buy off the shelf, plug in, and kind of put all these things together. That being said, we recognize that there may be challenges ahead, but this contemplates getting us to the highest level of the state of the art of what is available in the policing profession today. As I mentioned, it is not punitive, and it is meant to correct behavior before it becomes problematic. It is also not a panacea. It is not going to solve all our problems. As I've said before, we will only be as good as an agency as our worst supervisor. So it takes a supervisor being able to take information from this system and go through it and identify, with a clear way towards accountability, what can we do, how best can we help this individual officer to improve their performance. So that still remains what ultimately we will need to be doing as an agency as we look to continue to improve upon our culture internally, and this will help us do that. That being said, to get into some of the technicalities with it, we have the MPD's EIS manager is here, Nick Barclay, and he can go through some of the specifics.
Good morning. My name is Nick Barclay. I'm a civilian member of MPD's Early Intervention and Health and Wellness Units. Thank you, Mayor, Chief O'Hara, and staff for inviting me to participate today. I'm excited to be sharing some great work that's being done across the city when it comes to EIS. Early intervention systems used by frontline supervisors to assist in managing performance of their teams. EIS creates opportunities for supervisors to remain connected to their direct reports by using data to objectively identify officers who are performing well and those who may need to be redirected towards the goals, missions, and values of the police department. Regardless of industry or profession, we know that happy, healthy humans produce the best work. In law enforcement, early intervention with employees who are known to be struggling, connecting them to resources such as training, mentorship, mental health, or something as simple as a check-in or an extra day off can be all that is needed to reorient the officer's career and reduce the likelihood of an adverse event. With the addition of automated processes through benchmark analytics, we will be able to do this faster, we will be able to do it more accurately, we will be able to do it more holistically, and we will be able to predict who is likely to have performance issues and intervene before those issues can even occur. Benchmark Analytics is the industry leader in police early intervention systems. Supervisors using Benchmark will have direct access to consolidated information, as the Chief mentioned. The system will allow supervisors to conduct evaluations of individual officers' performance, as well as a comparative analysis across their peer group and other units within the department. The automated predictive capabilities of the Benchmark system will make trend spotting more accessible, allowing supervisors the opportunity to address problems or to recognize the outstanding work that we already know is being done today. Part of what makes Benchmark so successful is the fact they are a company built on research. Benchmark has demonstrated in several cities across the country that compliance with settlement agreements and consent decrees is possible. Benchmark is partially owned by the University of Chicago, where researchers play a key role in the development of predictive models and algorithms that identify patterns of officer conduct that can lead to at-risk behavior in policing. We are very excited to be bringing the technology and expertise to Minneapolis. Our team has already been working in preparation for this partnership, and we will be ready to begin integrating data into Benchmark systems as soon as we can. Within the first 60 to 90 days of the contract, we will have a full project plan in place, and we'll have fully identified the estimated 15 to 20 data systems which will be fed into the EIS. Within 180 days, we hope to have enough data flowing into the models to begin a pilot project within the department. We expect training for supervisors and officers to take place in early 2025 and hope to be fully operational within the first year of the contract. In addition to ongoing funding from MPD and IT budgets, this project is being partially funded by a generous grant from the Pollad Foundation. As was mentioned earlier, through that agreement, we have also been connected to very key strategic partners in the National League of Cities and have developed local partnerships with Ubuntu Care Services and Rainbow Research. The work being done by NLC, Ubuntu, and Rainbow has been instrumental in assisting us in engaging the community about EIS via the Reducing Harm Through Collaborative Solutions initiative. And we look forward to drawing on their expertise moving forward when we begin to evaluate the success of the early intervention system after it's implemented. Lastly, I want to recognize the collaborative effort of many people scattered throughout the enterprise who have made this procurement process successful. On behalf of the EIS and Health and Wellness units at MPD, thank you for your work on this project. And with that, I will hand it back to Mayor Frey.
Thank you. I'll open it up to questions, but first, want to just say what a big deal this is for our city, a big deal this is for transformation within our police department, and giving officers the necessary tools that they need. A huge thank you to the Pollad Family Foundation and Susan Bass Roberts. They were there very early on to make sure that we had the necessary resources, both in terms of people and in terms of the money, to get this done. And it's going to help a whole lot of people. With that, I'll turn it over to questions. Yeah, Kyle.
We talked about patterns that get flagged. What are can you give some examples of the types of patterns that would flag an officer for review in this system?
It's a great question, and I'm going to turn it to either our chief or the chief of police.
So, Kyle, like I mentioned, this is to identify outliers, right? So first we would have to get all of the various data systems in place, pull them together, and kind of see what it looks like, right? This is more than just only looking at, like, for example, complaints against police, which might be in an IA system, OPCR system, where you could say, if you have 3 complaints in 12 months, that would be a flag, or, you know, maybe 1 complaint of a certain type would automatically be a flag. It contemplates adding that to everything else that we know. What is the overtime that the officer is working? What is the off-duty time that the officer is working? Are there patterns in the officer's attendance record? Are there patterns, underneath any other HR data, stop data, arrest data, all of those types of things. So it is not just like one flag, for example. There will be lots of them. but it is to identify, best I can describe it is to identify outliers that may be problematic.
So there's not like a definitive list of
No.
what those flags are at this moment?
No.
And if I'm describing it, it's like, it's not just complaints against an officer, but it's like maybe this officer is putting in too much overtime, or they're working too many off-duty assignments, and then it's like, hey, what's going on?
So it's really important to note that this is not just complaints against police officers. That is an essential piece of managing police officers. The reason why this type of thing is hard, and most cities do not do it, is because it's expensive to pull in all of these other data systems that exist and pull information out of it. What do the stops look like that the officer is making? What does the arrest data look like? What is the off-duty work? What does their overtime look like? What are their patterns in attendance? Are they, do they happen to call out or not work, every other Friday or something, during a certain time of the year? It's pretty extensive in how far you could get, but again, two things. It's only as good as the data that's getting put into the initial system in the first place, and two, we're only going to be good as the supervisors who are reviewing it to ensure that there's follow-up.
Chief, can I follow up really quickly? So you have this data, and we use the term flag. So does this software basically give you parameters or slots? Okay, this Officer X is flagged for, he has 3 of these flags. I mean, at some point there has to be a decision made from the supervisor
Yes.
whether or not it reaches a threshold that you need extra intervention. Is that basically how it's going to work?
That's essentially it, but what we need to do is once we decide what the parameters are, as soon as there is a flag, there needs to be supervisory review and a determination of whether or not intervention is needed. There may be a very good reason, perfectly acceptable reason why the officer is in certain situation or a certain work context that is different from peers. But peer group is also relevant to this. An officer working that works, around bar close downtown, every weekend may look different on paper in activity from an officer working an overnight shift, elsewhere in the city. So it's peer group is important, as well as department-wide. And you need to be thoughtful about how you deal with these things.
It sounds like this system really focuses on tracking officer behavior. Is there a blind spot when it comes to those supervisor roles?
There are, absolutely. And again, it is making sure that, we're getting the correct information into these systems to begin with, and that, the technology is working appropriately. But the only way, like anything else, the only way that this will be effective is in the implementation, is in the follow-up by the supervisor and having accountability over that process.
What sort of interventions will be possible? Is it just referring them to PTSD resources, for instance? Or?
It's a wide range. All sorts of things like what you mentioned are related to health and wellness. But I think, in my experience, frequently it's training. Frequently, it can be just simply putting an officer on notice. They may not be aware of certain things, maybe not be aware of complaints that have been made. They may not be aware of, some of their behavior which may be problematic. But in many cases, many cases, initial flags are not indicative of a problem at all. So again, it's very context dependent. And it requires a thorough review. It's not just something we can depend on an algorithm and that's it.
Is there a hope that this might stem some of the departures from, say, disability?
I do not think there's a direct correlation. The hope is, over the long run, that we will have fewer people getting to that point in the first place. But I think it's, it would be disingenuous to not acknowledge what everyone has lived through here in the first place. We can't take that away.
I hear that you're saying this is about a proactive intervention and it's not about policing interactions or complaints. On the other hand, the department has been criticized for referring officers for coaching when discipline is appropriate, and this might sound to some people like coaching 2.0.
Yep.
So, I mean, how would you answer the concern that this is another way of redirecting people away from discipline? You're saying this is not discipline, but maybe there's discipline required.
This is a much higher level of intervention, of early warning before behavior becomes problematic, which is, I think, what people say all the time. How did they not know an officer, could be in a position where something like this would happen? That is the answer to that. I understand people have questions and frustrations around coaching, how that has happened here historically. But the reality is we need to correct officers' behavior. We cannot run away from that. And a lot of times, like I said, that does involve training officers. And that is a good thing if we're able to correct behavior, before it becomes more seriously problematic.
And then the fund, unless someone else has anything, asking too many. The funding coming from the Rollout Foundation. I mean, if this is if this is a part of the settlement, how long does the funding run, and does it run for as long as is necessary to fulfill the terms of the settlement agreement? I mean, like, if this is necessary under the agreement and it's funded by outside sources, is that sustainable?
I'll pass it off to Nick Barkley in a second to provide more of an explanation. Keep in mind that there is both city support in this as well as the private philanthropic support. And if you look back 3 or so years, we initially tried to get this program through the council, and it failed in the first budget cycle. We then succeeded in getting the necessary funding in the second. Then we were able to start moving forward to set up this platform, to work to make sure that it was customized. As the chief mentioned, this is not just about getting Microsoft Office out of the box and plugging something in. This is a whole lot of customization to what our department needs and to the different technology systems that we already have collecting data. So look, we didn't do all of this work to not continuously fund this program. We are going to continuously fund an early intervention system. It's critical. Do you want to know the exact numbers on it? I think someone else could probably.
Yeah, that'd be helpful. We could do that.
Yeah.
Would you say and spell your name? I don't know if you need to.
Sure. My name is Nick Barkley, Barkley. The Pollad Foundation, through the initiative Reducing Harm Through Community Collaboration and Solutions Initiative, graciously funded the department with $700,000. $500,000 of that was specifically for the implementation of the EIS. The ongoing, or the 5-year contract value for the contract with Benchmark is $2.375 million, which is being drawn from a combination of MPD budget and IT budget, and has been funded through 2029. So there is a commitment from the city to have this funding out for a long period of time to get the system up and going. We hope that within the first 2 years we will show that it's worth it and that they will continue funding it. However, we are very grateful for the Pollad Foundation for helping get us that money to get us off the ground and get going.
Pollad money is part of the 2.5?
Yes. Yep. The Pollad money will be dispersed in years 1 and 2 of the contract.
Is there an example of this vendor's effectiveness in other cities around the country?
So we did an extensive vetting of this product, both in cities where it's been exceptionally successful and in areas where there's been other problems that have occurred that have prolonged its launch. What we heard consistently throughout all the people that we talked to was that the staff at Benchmark is exceptionally responsive to any issues and works collaboratively with their vendor cities to fix problems and get things up and going. We feel very comfortable about that. In terms of, sorry.
Can you share which cities?
We have spoken with Charlotte-Mecklenburg Police Department, Baltimore Police Department, Albuquerque Police Department, Nashville Police Department.
Thanks.
Thanks.
Yeah, thanks everybody. Thank you.